Measuring the central venous pressure. Procedure. First, gather the necessary equipment. Then, confirm the client's ID using two client identifiers according to facilities policy. Then, provide privacy. Next is explain the procedure to the client. Wash hands and don gloves. Then, connect the IV tubing to the manometer. Prime the IV tubing. Ensure all air bubbles are removed from tubing. Set up the manometer and attach to an IV pole. Connect the IV tubing to the central venous line. Label the IV solution and tubing. Then, set the bed on its lowest position. Place the patient in a flat position. Place in a semi-Fowler's position if cannot tolerate. Next, locate and mark the right atrium as the zero reference point or phlebistotic axis on the fourth intercostal space at the mid-axillary line. Then check IV fluid if running well. Flush the central venous catheter to ensure patency. Align the base of the manometer with the zero reference point by moving the scale up and down to allow the bubble to be aligned with zero on the scale. Secured it in place. Turn the stopcock off to the client and slowly fill the manometer with IV solution until the fluid level is 10 to 20 cm H2O, higher than the client's expected CVP value. Do not overfill the tube. Allow the fluid to fall with gravity and mark in the manometer the level where fluid stops falling. Read the measurement on the bottom of the meniscus or at the midline of the small floating ball. Note the CVP at the end of patient's expiration. After obtaining the CVP value, turn the stopcock to resume the IV infusion as indicated. Then confirm the stopcock is turned so that the IV solution port, CVP column port, and client port are open. Place the patient in a comfortable position. Remove gloves and wash hands. Evaluate the CVP reading and compare to the baseline. Report significant findings and clinical changes to the physician. Document CVP reading on the flow sheet and note the following: condition of the catheter insertion site and complications and actions taken.